The order that I use in order to lower LDL and the counseling that I give to patients is first a reduction in saturated fats and trans fats in their diet. And there's a lot of room for improvement in the reduction of those fats. Once we go past that and the patient has made those dietary changes, we may have the patient increase their physical activity to a prescribed specific amount that will also reduce their cholesterol further. When a patient has tried lifestyle modification, and I usually give them several months of doing so, retesting things. Sometimes I'll give them a couple of chances and a couple of retests. I have a systematic process whereby I evaluate when it's the appropriate time to start a statin. So each patient needs to really be individualized as to which statin medication. And sometimes, in some instances, if a patient is on a maximum tolerated level of statin or on a maximum dose that is available for the statin and they're still not getting to goal, I may need to add another medication on top of the statin as well. An honest look at the treatment of cholesterol is that there are limitations to all of these types of treatment options, whether they be lifestyle or whether they be medication. That you're only going to achieve a certain level of improvement with any one of these things, and even in combination, only achieve a certain level. We know that with exercise, for example, we can have an impact on our HDL levels. We can raise our HDL and perhaps lower our triglycerides, but LDL tends to be sort of stubborn and not really move with exercise. The limitations also extend even to medications. We know that with medications we can only get LDL to move to a certain level, and for some patients they need more than that level to get to their goal. We know that with even powerful statin medications, they only have a certain amount of LDL reduction that they can achieve. And I think that patients come in and they can blame themselves for not achieving goals, or they may be frustrated that they're not achieving goals. All of these different changes have to sort of be balanced, and it's very important that this is part of an entire treatment algorithm, and that algorithm is a systematic approach to treating cholesterol that involves lifestyle, which involves dietary modification, increased physical activity, as well as the potential for medication. So it's not a one-size-fits-all type of disease. It's very individualized, the approach to this disease, and we have a lot of different treatment options that are available. Achieving your cholesterol goals is just the first step, but it is a lifelong and ongoing process that a person needs to continue indefinitely, whether that means a permanent lifestyle change through diet or exercise, or the introduction of a medication. That cholesterol level needs to stay low, and the only way it's going to continue to stay low is through the maintenance of those changes.